Hello, I'm Tamara Pope, Vice President Marketing and Communications at Hamilton Health Sciences Foundation. As our Innovations in Vital Care series continues, we hope that you are enjoying hearing from some of the experts at Hamilton Health Sciences. For this week's episode, our focus turns to spine surgery. Dr. Devin Peterson is an orthopedic surgeon at Hamilton Health Sciences, and he will speak about exciting innovations in spine surgery for both pediatric and adult patients. For today's episode of Innovations in Vital Care, it's my pleasure to introduce Dr. Devin Peterson.
So here to talk to you a little bit about some of the innovations at Hamilton Health Sciences, looking at some of the spine surgery that we're doing. I'm going to introduce first, maybe what I do and what my group does here at McMaster, and then I'll sort of go from there. So I'm part of a pediatric orthopedic surgery group at McMaster Children's Hospital. And what orthopedics, obviously the pediatric part is dealing with kids. What we really do is musculoskeletal medicine. So it's bone, joint, and soft tissue surgery as well as non-surgical things. When you're looking at sort of some of the stuff we do, so some is really, really simple to understand. So acute fractures, injuries in athletes where they might tear an anterior cruciate ligament. We also deal with a lot of children that have more chronic disorders, some syndromes, cerebral palsy, spina bifida, some that have growth abnormalities and things like that. So some of the other things we deal with is hip dysplasia. That's one of the big things that our group does deal with. Children that are growing properly will sort of help modify how they grow and things like that. And then one of the big things we do is spine surgery, which I'll talk to you a little bit more later about that. As well as a non-operative or operative part of the surgery and looking after kids, we also act as educators. We have medical students, residents, fellows, that sort of thing. A lot of my group is heavily involved in research as well, both in children and adults. What I really want to talk about today is really the important part of my practice, which is spine surgery. And there is significant overlap, obviously, and I'm going to talk about what some of my adult colleagues do as well. Significant overlap between, what we do in the Children's Hospital as well, what we do at other centers, mainly the Hamilton General Hospital. And also a lot of overlap in who does what. So we have both orthopedic surgeons, so again, the musculoskeletal people, and then you also have neurosurgeons that deal a lot with spinal cord injuries, spinal cord pathology, head injuries, head trauma, tumor, stuff like that. So there's quite a bit of overlap, and we often work together with a number of cases, and that's some of the funner surgeries to do when we're all kind of working together. It's quite enjoyable to do that. Some of the surgeries that we do, and again, we're going to get to this innovative part of it in a minute, but a lot of the stuff that we do, and more of my adult colleagues would deal with spine decompression. So people that, as you get older, sometimes the bones and the tissues around the spinal cord get really tight, so they need that release. Fusions, whether it's for this type of decompression where they have to take out a lot of bone and the spine's a bit unstable, they got to fuse it, or for other reasons. A lot of people know about sciatica, sort of disc herniation, so deal with a lot of that. We all do tumor surgery, both at the Children's and Adult Hospital, and then trauma as well, so any spine fractures. I want to talk a little bit about the deformity surgery that we do, which is done at both sites, a little bit more in the Children's Hospital, but things like scoliosis, which is sort of a three-dimensional deformity of the spine, where the spine's sort of crooked as well as rotated. So it's one of the things I will get back to again in a minute. So what I want to talk to you about is a very innovative piece of equipment that we've now been able to obtain at Hamilton Health Sciences. It's called the OArm, and we have one at the McMaster Children's site as well as Hamilton General. And what it is, it's actually a portable CAT scan machine, which is really quite amazing. And what it does is it can take sort of a picture of the patient in the operating room when they're asleep and convert it into basically a three-dimensional type of image. A couple important things about it is it's low dose, so the radiation exposure is less than your normal CAT scans. And for us, doing a lot of children's work, that's very important because children are more sensitive than adults to radiation and some of the problems you can get from that, such as some tumors and stuff down the road. And then the really kind of neat part of it is once the image is done, it's kind of stored in the computer. And then we can actually put some markers on the spine, and then it becomes a navigation system. So almost like a virtual video game, to some extent, where we can sort of move things around and actually see what we're doing, but they actually can see it on a screen what we're doing inside the body. So it's quite neat, and I'll show you that in a minute. And that part of it doesn't have any radiation. It also allows us to not have to wear protective equipment. So for those of us that have had back problems in the past, those of us that might be getting a bit grayer, a bit older, that's an important part of it as well. So we can at that point, we can take off our lead, as opposed to before we used to have to wear it for like sometimes 4 or 5 hours, and the lead was very, very heavy sometimes. So the other important part of this is the image that comes out is this amazing 3-dimensional image. And it also makes it safer for what we're doing. So we put a lot of what we call pedicle screws. I'll show you some pictures in a sec. It's a little confusing, but we actually put screws from the back of the spine all the way into the front of the spine through the bone. And we're at any one given time where we're kind of 1 millimeter to 2 or 3 millimeters away from maybe the spinal cord or something else outside of the area, which could be like a big vessel, the heart, the lung, that sort of stuff. So there's not a lot of room for error in these types of surgeries. And this is sort of a picture. Obviously, this isn't a real person, this picture, but I think it's one of the better pictures you can find. And this is very similar to what we see in the operating room. So we can see up different angles. So there's sort of that 90-degree angles to what we're doing. And we can certainly see. So this is what we call our pedicle here, which is this sort of space in between there. And what we want to do is we want to put a screw right down there, right from the back of the spine all the way around to the front. And we can actually see this on different views on the image. And I'm going to show you this again, and I'll show you kind of what we were doing and what we are doing, which I think is kind of neat. So I'm just going to introduce this as sort of a standard scoliosis patient. And again, you can see that there's quite a curvature of the spine here. I believe this measured about 65 degrees or so. And then what we do is we put a bunch of screws in these pedicles, we attach some rods, and we straighten it out. So we can see this is the same patient post-op. She's got all these screws in her spine there. She's got the rods. We've been able to bring her down from maybe a 65, maybe to a 20-degree or less curve. So quite a significant correction. And just to finish off, I'm just going to show you what we used to look at and what we now look at. And I think this really shows you a little bit what this innovative technology can do for us and the difference it can make in our patients' lives and safety. So typically what I do, and this is actually a picture of somebody that I'd have in the OArm, would have a X-ray machine that would use for all these sort of screws, at least where we do at McMaster Children's Hospital. And I'd see this round circle part here, and this is where I want to put the screw, but I don't know in any other plane, where this screw is going to go. So we sort of do it. We know what we're doing. We're very skilled at what we do, and there's many safe ways to do it. But when you look at this picture here and you say, okay, so I'm looking at this, I'm putting a screw down this hole here, and I got to make sure I got it in the right plane all the way. Versus, let's look at this picture here, where I can actually see the screw, and this is actually a top. Well, you can actually see where the screw goes in there. So this is just amazing, and although it took a few times to get comfortable with any new technology, you're kind of like, I'm not sure I trust it. But after a few times using this, it's like, wow, this is just so much better, quicker too. Like the other day, somebody said, wow, you've got like 6 or 8 screws in already. Like what happened? So it's quicker. And once you get confident with it, it's pretty amazing. So we go from something like this where you're a little bit nervous to something like this where you're feeling a lot more comfortable. So there is still uses for an old system. We don't use the navigation for everything in the spine, but certainly it's been a big benefit. I'll just throw out there as well, there's other uses for it. We use it for some of our hip dysplasia kids, where we used to actually put casts on some of our children, and then would have to get some x-rays. And the x-rays were good. You couldn't really tell as a hip where you wanted to be, so then you'd have to wake them up, send them to a CT scan outside of the operating room, and if it wasn't good, you had to bring them back to the operating room and then put them back to sleep. So now we just wheel this machine in while they're asleep. We do the scan right there. It looks good or doesn't. We just deal with it while they're still asleep. So although we use it mainly for the spine, there's also other uses for it, and it's been quite fun to learn how to use it. And I think we're going to have some great results with it in the future.
Well, thanks so much, Dr. Peterson. That was really interesting, and I think the imagery that you showed really illustrated how even just a tiny a millimeter can make a difference.
Yeah.
And I'm just wondering, how big are some of those screws? Because they must be tiny.
Yeah, they vary in size depending on the patient, but you know, some of them are 4 millimeter, 5.5 millimeter, and the challenge and what I like most really about this new technology is I can actually see how wide these pedicles are that we're putting the screws in, because before you can't really tell that, but this three-dimensional image lets me know. So once in a while, if you're putting a screw and you realize it's too big, you realize it might break out the bone a little bit, then you can just change it for another one. Whereas before you kind of didn't know until you realized the screw was a bit loose and you had to maybe bail on that pedicle. So, but yeah, it can be very tiny. And again, the younger the kid, the tinier the screws and stuff.
And I would imagine as well, being able to work in 3 dimensions allows you to see how close you are to sensitive vessels, spinal cord, and things like that.
Yeah, absolutely.
And actually, you mentioned younger patients. Are there significant differences and challenges when you are dealing with extremely young and smaller patients?
Yeah, you know, Aaron, it's very interesting. You know, some of the stuff that we see here in some young children that have like really significant curves starting at like age 1, 2, 3 sometime. And when you have that situation, there's not typically even instrumentation that's small enough to deal with those. So a lot of these kids, what we're doing is we're putting them in casts, we put them in braces, and we try and buy some time until they get sort of old enough that we can then put some hardware in them, some screws and some rods. And usually for the younger kids, we're doing things called lengthening rods, where because you have so much growth left, you don't want to just, you know, put stuff in and stop them from growing. So you really want to sort of help them growing. So we put things called lengthening rods in them.
And I can imagine it must be really fulfilling knowing, especially with much younger patients, that you're making a difference that will help them grow into adulthood. You know, at an early stage, you're really making a long-term difference for a lot of these patients.
You're fixing a broken bone, you're fixing a problem, and you're really helping people improve their function. And sometimes I'm surprised, like what a difference you make. Like I've had kids, you know, basically give me thank you notes, you know, years down the road, and just say, "Wow, you've changed my life." You know, so a large part of it, and I think you get that from adults too, but again, I think for kids, they have a different perspective. Right, and you're really changing that period of their life when they're supposed to be having the most fun, and it's just an exciting time. So yeah, a lot of the stuff we do is very enjoyable. You know, our specialty is really more about function and improving, you know, pain and stuff in a lot of cases as well. So there's a lot of fulfillment in that for sure.
Wonderful. And here at Hamilton Health Sciences Foundation, we're very dedicated to raising donor funds to help ensure that you know, physicians like yourself and teams at McMaster Children's Hospital, Hamilton General Hospital, Karolinski Hospital and Cancer Center, St. Peter's Hospital, have all the tools and equipment that they need to do their work. If you could say anything to donors, if you had any message for potential donors, what would you tell them?
Well, first, I'd say thanks. You know, it's very, you know, interesting. We have the top healthcare system in the world. I think everybody knows that. But there's limitations with the funding, and often innovation outstrips the funding for a lot of the stuff we have. And you just can't keep up with the rest of the world without donors. Like you just can't. And it's not just about keeping up some new toys. It's about doing things better, doing things safer. You know, make sure patients are treated, you know, top notch. And that's what the donors do. And you know, it's unfortunate sometimes that I know the donors understand they're doing such a good thing, but they don't see the day-to-day stuff that I do, right? When I see a patient that's really benefited from something that the donor's done, and whether it's a clinic or a piece of equipment or something like that, but like you don't see the day-to-day stuff, and it's too bad they can't, because some of the changes that they're making in people's lives that they may not know is just amazing. So some of the cases we do are just as difficult as any place you'd find any place in the world, to be honest. You know, so it's great to have that support, and very needed a lot of times as well. Yeah.
Yeah. And I think one thing a lot of people don't often realize is hospital equipment and tools do have a shelf life, and a lot of it does need to be replaced and replenished. And And as technology develops, hopefully you always get improved equipment and tools, but everything has a shelf life. So it's the need is never ending.
Yeah, you're right, Aaron. And, and again, it's not kind of like, buying that new car. Well, maybe it is sometime, like use that new car as a few more safety features, right? You update every 4 years, like, wow, this is so much safer. We got cars that can pretty much stop by themselves and park themselves and that sort of stuff. Same sort of thing. So the innovation, again, isn't all just about the flash and the pizzazz. A lot of it is just, it's increased safety, right? And I think, as you said, there's always a company got to do something better. And anything we do for our patients that makes them safer, makes them more comfortable, I think is important. And that's, again, where the foundations really make a huge, huge difference, to us, because they allow us to do stuff that sometimes public funding just doesn't allow. And it's we got a wonderful system, but, again, having donors help out is just amazing.
Wonderful. Well, thanks so much for taking the time to speak with us today. That was really interesting. So thanks so much. I really appreciate that.
Thank you. It's actually a privilege to speak today, and to thank the donors, because a lot of them, we don't get to thank them directly like this. So thank you all for everything you guys do, and my patients really, really appreciate it. So thanks a lot.